You're listening to InjuredWorkerCast, conversations in health and safety and workers' compensation in Ontario, Canada, and beyond. InjuredWorkerCast is produced by Injured Workers Community Legal Aid Clinic and is not a substitute for professional legal advice. For more information on workers' compensation issues, campaigns, and resources, visit injuredworkersonline.org. Today we're hearing from Tebasum, Durani, and John McKinnon, who are both lawyers at Injured Workers Community Legal Clinic. John and Tebasum are discussing how Ontario's Workplace Safety and Insurance Board, or WSIB, is funded, why it is funded that way, and also a controversial decision for Ontario's WSIB to hand over $2.5 billion to employers in the lead-up to an anticipated spring election.
Ontario's government recently announced that the Workplace Safety and Insurance Board, the WSIB, will gift over $2 billion to employers in the form of rebates and bonuses. Billed as a measure to keep costs down for businesses, it comes at the expense of injured workers, whose benefits have been reduced for the past 25 years. For these number of years, the WSIB has been reducing premium rates for employers, but the idea of actually giving money back to employers hasn't been that common. To break all of this down, we're joined by John McKinnon, the Executive Director of Injured Workers Community Legal Clinic. John, I'll start by asking you whether the practice of the WSIB giving back money to employers via rebates is a new practice?
Yes, thanks, Tebasum. This is a brand new practice. There has for many years been another form of rebates under a program called experience rating, but that's a completely different thing. We first heard about this type of rebate in terms of giving back the premiums collected from employers en masse to employers just before the last provincial election in June 2022. The WSIB announced it was going to be giving back $1.2 billion in rebates to employers because it had more money than it needed. And now, again in fall 2024, just before the next provincial election, the WSIB has announced that it's going to be giving back a total of $2.5 billion, most of it going to employers because the WSIB has more money than it needs. And ironically, the $2.5 billion is roughly the same as all of the benefits paid to injured workers in the year 2023. We've never before seen rebates like this because of the way the WSIB was funded. When it was originally set up as the Workmen's Compensation Board back in 1915, the funding of the WSIB was set up on what was called a current account system or a pay-as-you-go system. So the WSIB would charge employers enough assessment rates based on their payroll to pay for the expected cost of benefits for injured workers over the next year and set aside some money as a reserve fund in case of, an occupational disaster, whether it's a disease or a mine cave-in or some particularly expensive health and safety concern. And so it basically functioned on that way on a pay-as-you-go basis, collecting enough money to cover benefits for the next year and keep a reserve fund for more than 100 years. After the 2008 financial crisis, that led to concern about the WSIB's investments. The money that it's not using for immediate benefit payments is put into investments for this reserve fund to cover future contingencies. The value of those kind of investments decreased significantly in 2008. And so that raised concerns about whether the WSIB was adequately funded. And the WSIB funding has always been different than the way it works for a private insurance company. Because a private insurance company is just a private company and could go to business tomorrow and shut down, it's required by law to have enough money in its bank account to cover all the future claims, all the future costs of the claims that are on its books, so that even if the company shut down tomorrow, none of the insured people would suffer because the money is there to pay for the benefits that they've been assured. That was necessary for a system like workers' compensation because it's based on the payroll for industry in the entire province. And the entire province is not going to go bankrupt or shut down tomorrow. So there will always be a source of ongoing funding for the compensation board. However, the people who were concerned about the WSIB funding and the costs included the Auditor General. And the Auditor General took a look at WSIB funding the way it would look at a private insurance company and said, you have a big unfunded liability, even bigger now because the financial crisis decreased the value of your investments. And you should have enough money on hand to pay out all your future costs of all your claims, the same as any private insurance company. And the Auditor General said that if the province doesn't do that, it's going to add the unfunded liability to the province's debt. And the unfunded liability at the time was, I forget now, maybe $12 billion or something. It would do a huge damage to Ontario's credit rating if that was added to the province's debt. And the Auditor General said there's only 4 ways you can deal with this. You could go to universal coverage, cover all workers in the province, but that's not going to get you really enough money to eliminate the unfunded liability, to keep all those big reserves. You could increase the return on your investments, but that's not really within your control. You can't go and make riskier investments to get higher returns because if you lose, there's nothing there for the injured workers. And you could raise the rates paid by employers, but at this time, businesses are having a very difficult time, and it can have a negative effect on our economy. And so the only thing left that you could do is to reduce the benefits for injured workers. And the Auditor General left it to the government and the WSIB to decide what to do. And they decided that they would pursue an aggressive strategy of benefit reductions based on hiring a cost-cutting CEO at the WSIB, a fellow by the name of David Marshall. And he was given a mandate to improve the WSIB funding, and he would get paid a bonus for doing that. And in his interview with the Standing Committee of the Legislature that was doing the sort of hiring interview, his words were, it's going to take some tough programs. He said, you can't recover that amount of money without some pain in the system somewhere. And so from that point on in 2010, the WSIB pursued a fairly vigorous campaign of finding ways to control and reduce benefits, and also to look at the way they fund the system. They hired a retired law professor and mediator, Harry Arthurs, to do a study of WSIB funding, and he came out with a report in 2011, which was called Funding Fairness, which came out with an approach to WSIB funding that would reach 100% or no unfunded liability by the year 2027. And so that was adopted by the WSIB CEO, and they followed through with their tough measures to reduce the benefit costs, and found that they reached the full funding mark almost 10 years ahead of schedule. So by 2018, the WSIB was already 100% funded, no unfunded liability. And so This is the first time that the WSIB ever had enough money on the books to pay out all future claims. And in, I guess, 2021, the government changed the legislation, changed the Workplace Safety and Insurance Act to include a provision that says, well, if the funding ever gets up to 115%, the WSIB can start giving it back. And if the funding ever reaches 125%, the WSIB must give money back to employers. And so by the year 2022, WSIB funding just nudged up over that 115% mark to 118%. And that's when the WSIB and the government announced that they would start giving money back to employers. And so in 2022 was about, I think, $1.2 billion was returned to employers. And it's a huge amount of money relative to any other terms in the economy. I recently had it explained by a retired law professor who said that to count $1 billion, if you were to count $1 at a time, nonstop, day and night, it would take you 20 years to get to 1 billion. And so that's a significant amount of money. But now in 2024, the government has announced that it's at 122% funding. So it's going to give $2.5 billion away. And so these are the first two instances of this type of rebate.
So to play devil's advocate, if employers have paid more than what the WSIB needs to function or to do what it's here to do, what is wrong or problematic with giving back the overpayment?
Well, what's really unfair about that is that they reached this high level of funding through the so-called tough measures of cutting benefits for injured workers. And that actually began some time ago, back in the 1980s. Employers were raising a concern about the rising cost of paying for workers' compensation and were demanding that benefits be cut in order to control those costs. And so in 1998, the Mike Harris government changed the Workplace Safety and Insurance Act to reduce the main benefit paid to injured workers, the loss of earnings benefit. At the time, workers who were injured, disabled from working at all, would receive 90% of net of their regular earnings, and that was reduced to 85% of net of the regular earnings. And the other reduction was that when workers are on workers' compensation and receiving loss of earnings benefits, so they're not working, they can't contribute to the Canada Pension Plan, or they don't have an income to contribute to any other pension plan. So the workers' compensation system provides for the loss of retirement income. And up until 1998, an amount equal to 10% of the money that was paid as loss of retirement income was put into an account for the injured workers to be paid out to them when they reached age 65, the normal age for retirement. And the government reduced that contribution from 10% down to 5%. So those benefit reductions continue to this day. And since 1998, when injured workers have asked to restore their benefits to the previous levels, they were always told, everyone has to tighten their belts. Wait until we get the financial house in order, the WSIB, and then we can look at benefits improvements. But now we see that the WSIB finances are in very good order, and still the government and the WSIB is not willing to look at benefits improvements. So those are just a couple of the benefit cuts that have been experienced since then. A number of other things have happened as well, which have had a negative impact on workers' compensation. One is that back in 2007, mandatory retirement was outlawed, was eliminated under the Human Rights Code, and a special exemption was given for workers' compensation, which has a number of age 65-based limits to benefits. And so we're in a situation now, 17 years after mandatory retirement was outlawed, where many workers over age 65 have no choice but to continue working for financial reasons, but they get limited or no benefits from workers' compensation if they get injured. So that's another injustice that needs to be remedied. And also, injured workers' benefits have been greatly reduced by the practice of deeming, where the WSIB will reduce their amount of compensation for lost earnings based on what they think a person might be able to earn if they got a job out in the job market. And the reality is that permanently injured workers are not getting those jobs, and so they're getting undercompensated. Another recent event which happened, a decision by the Workplace Safety and Insurance Appeals Tribunal pointed out that the way that migrant workers were compensated for their injuries was significantly undercompensating them for the losses that they've had when they're not able to continue performing work on the farms in Ontario. And the WSIB has been ordered to make fair compensation to all those migrant workers who were undercompensated. And there are also a number of issues around healthcare benefits, healthcare matters which are not being properly covered by the WSIB. And those reduced benefits need to be addressed. There's certainly no such thing as a surplus of WSIB funding until there's fair compensation for injured workers and all of the cutbacks have been eliminated.
So in light of this, what improvements can and should be made for injured workers by the WSIB?
Well, there's a very comprehensive list that was put together by many of the injured worker organizations across the province. Organizations like the Ontario Network of Injured Workers Groups, the Occupational Disease Reform Alliance, Disability Without Poverty, the South Asian Women's and Immigrant Services, Thunder Bay and District Injured Workers Group, Windsor Injured Workers Group, and a number of the community legal clinics had input in this too. It's called What Injured Workers Need, and it's probably available in several sources, but you can find it on the Injured Workers online website. And that lists the benefit reductions that I've just talked about and a number of other improvements that are needed in workers' compensation before we can say that there is any kind of a surplus in the system. And so it's important for the WSIB and for the government to address the concerns raised in the What Injured Workers Need document before thinking about giving away any more of the compensation that's been collected.
Okay. Thanks very much, John.
You're listening to Injured WorkerCast, conversations in health and safety and workers' compensation in Ontario, Canada, and beyond. Injured WorkerCast is produced by Injured Workers Community Legal Aid Clinic and is not a substitute for professional legal advice. For more information on workers' compensation issues, campaigns, and resources, visit injuredworkersonline.org.